you, sir.
Thank you.
Hello. Thank you, ma'am. Our first lecture of the last session will be not just prescriptions, but the conversations and observation to matters. Our speaker will be Dr. Kalrav Mistry, sir. He is a psychiatrist and sexology expert, de-addiction specialist, having huge experience of 30 years, more than 10,000 patients seen. And over to Sir Dr. Kalrav Mistry, sir.
Thank you, sir. Good evening, all. Myself, Dr. Kalrav Mistry. I am consultant psychiatrist, sexologist, and a de-addiction specialist. Okay. So topics mostly given to me regarding the not just a prescription but the conversation and observation also two matters. So start with the definition of the professionalism. So what is actually professionalism would be there. It is mostly the shared competency, standard and ethics values they promise to uphold to their works, and also describes the skills, attitudes, how the values and behaviors we can indulge into common day-to-day practice. So professionalism includes the starting from the self-discipline group from the individual who are studying in the MBBS and completed graduation and the post-graduation and now enter to the practice. So his special relationship with those who serve as a patients as well as students, and also acknowledge their commitment in ethics and the morals and values towards the doctor-patient relationships. So as we know regarding the what is the stage of professional lives, at the start when the newcomers after the coming to the practice there is so much competitive worlds like the freshers. So initially work there is no work, no money, and there is plenty of times to engage with the patient. As we know regarding the seniors used to know there's the 1,000 days of practice, you have to wait for the practice for the initial startup. But nowadays there is a 1,000 days become the 2,000 and the 3,000 days. So as our previous prescription also regarding the what are the startups, Shark Tank and the AI we involved in the routine day-to-day practice, the newcomers like using the AI to increase their practice. In the last stage when you become the very senior after the 10 or 12 or 15 years of the professional lives, you have the lots of work, lots of money, but there is no time for yourself. As we literature also, so the doctors and the medical profession are turning towards the burnout syndrome, which is very much common in our days. So success is not a luxury, but it's the trust of the thousands of the patients. Until you put a very ethics and normal value, and also there is a no any unprofessional way like any discrimination. Is the many hospital is using for the unethical practice for the shortcut because of the arrogancy or some another practice. So malpractice should not be there. So the communication is the best advice in which is best assess in the medical practice. So today's successful doctors we have to be as a great clinician, great academician, great manager with the financial experts to learn the hospitality, whether it is a nursing staff or the corporate worlds. We have to be a CEO, family care provider. We have to take care for of the work-life balance also, and the self-care taker. Nowadays the doctor has to be updated for the social media marketing, also has to be in the creating awareness program for the social media like Facebook, Insta, Snapchat and anything else. So we have to be the influencer also. So now the doctor has to be another role also rather than the practice. So what is the actual facts? As we know regarding the burnout syndrome is very much common, and the mental as well as the physical health is 4 times most common among the medical professions. But sometimes when the professionalism is breached down because of the unethical practice, there are some guidelines like the abuse of the power, arrogancy, greedy, misinterpretation, or any fraud like with the government or impairment, like lack of consistencies and the conflict of the interest. Recently, 3 days before, there is an article in the Divya Bhaskars. So this is the fraud, while the unethical practice can interpret over the medical practice. So what are the actual DPR, the doctor-patient relationships? The practice of the medicine is an art, not a trade or not a calling, is not a business, is a calling in which your heart will be exercised equally with your head, like the empathy versus the sympathy terms, and also then increase the confidence between the doctor-patient relationships. So as we know regarding the DPR, doctor-patient relationship, nobody knows how much you know until they know how much you care about it. Rather than the medical practice, prescription or the surgical aspects, you have to also well care regarding the caregiver as a part of the patient's relatives to decrease the burden and decrease the compliance. Nowadays, what is the present scenario? Has the doctor has been changed or the doctor is facing change in the society? As we know regarding the Dr. Parth Patel, Dr. Yes Pandey, the new startups and also AI influence, Google Chat, WhatsApp University, that can influence our scenario regarding the treatment plan as well as the differential diagnosis. So what are the causes of the loopholes in the doctor-patient relationships? First is the good communication skill is assessed in the medical practice. Second is the medical students learn from the mentors, from the seniors, from the colleagues and from the role models. But there is a patient dissatisfaction, mistrust, medical litigation and professional negligence which can bridge the effective communication between the doctor-patient relationship. So these are the some guidelines. As for the examples, when the patients come to us, we go arrive for the consultation, we go do the clinical examinations for the advanced routine investigation, CT scan, sonography, MRI up to the PET scan for the differential diagnosis. From the doctor point of view, you have as much satisfied your patients. But what happens in the patient's mind when they go to the home or some another opinions? Nowadays the patient is concerned about the new symptoms. Whatever you give the advice from the prescription, they go through the AI, ChatGPT, Perplexity or the Gemini. Or this is a lots of WhatsApp University, ChatGPT or Dr. Googles. So patient receive the packet of information regarding the upcoming examination. The information will be inconsistent and includes the confusion instructions. Day by day the patients develop the mistrust and also searching for the second opinions. So nowadays why this hypochondria term is very much common. It means the hypochondriasis, the patient goes for the shopping for the doctors to doctors with the various file for the best outcome. So information start from the history of the communication. As we know regarding the history of communication, 30,000 BC, there is a petrogram, picturogram, then evolved into the transport systems. From there, in the 18th session, there is a Graham Bell invented telephonic communication. From then, there is a radio televisions, and from the internet, social media, multimedia, and then nowadays the social media marketing is there. So we know regarding the how the communication is involved, but from the care walls to the digital calls. So what is the communicative effective in the healthcare? There are 4 fundamental factors which increase the physical confidence as well as the increase the doctor-patient relationships as well as trust. First would be the active listening. You should be a good listener. Whatever you are, physician, surgeon or anything else, just be a psychologist, be a psychologist for the good listeners. And the clear and simple language. Avoid the medical jargon which can complicate the patient's confusion, can increase the patient's mistrust as well as anxiety. Be a simple with the clear communication. Third is ask the question. You have to ask the question regarding the patients, what is happening, what is your second thought, what are you completing the medical terminology very well or not, should I give you the reference or any documentation, so they can go for the search for the second opinions. So communication effective in the healthcare which increase the building the relationship between the patients as well as the doctors. There are the 7 C's of the communication. First is the clarity. Be clear goal about your line of treatment and the management, whether it is a medical management or the surgical management. Also there is the conciseness, to the point, rather than giving the confusion towards the patient. Be pinpoint regarding your line of the treatments. Be polite, very humble, increase the efficiency and also consider the socio-demographical details. If the patient is not unaffordable and you go for the any robotic surgery or anything else, give the according to the financial crisis, socio-demographical details, you have to put the options regarding the treatment choice. So the communication is the must in the very much fundamental things, because which increase the communication regarding the severity of the disease, prognosis of the disease, whatever the outcomes, consequences and what are the results should be there. So you should be very clear enough regarding the line of treatment from the diagnosis up to the terminal end. So there are the 3 major factors of the communication. We can communicate in the verbal communication as well as non-verbal communication. As we know regarding the communication, in mostly 7% of the words in form of the voices as well as the body language. It is the communicative language. But the communicating skills, it against the patient doesn't care how much you know them, they know much how much you care. Whatever you give the medical terminology, whatever your clinical expertise, you are the gold medalist, but you are very poor enough in the communication skill, and you may losing the patients. So communication is as critical as the ventilating patients, as a ventilation. Before the ICU, during the ICU, or after the discharge, you have to be communicative with your patients as well as the relatives. So there are some fundamental factors regarding the rapport building: eye-to-eye contact, detailed history, consents, positive body language, positive attitudes, as well as the empathetic listening. As we know, regarding the putting yourself in the patient's situation is called the empathy. So there is a cognitive empathy also, there is a empathetic empathy also. So developing the listening skill, maintain eye-to-eye contact, positive body language, and avoid the changing the topic whenever you are interviewing, like during the consultation, is there only chatting over the front, or using your social media gadgets, or distract your eye. Just be strict to your body language with the eye-to-eye contact and the smiling on your face. So whenever there is a answering the calls, like the weakest communication skill among the Indian medical professionals, there is a data. Indians context the patient satisfaction is largely when the quality of answers and the explanation given by the doctors, which will avoid the major terminology as the fancy or complicated words. We can criticize or also towards the patient, and can also increase the confidence, anxious, and the confusion towards the patients. So this is a ADCOM guideline from the NMC and the Neuromedical Counseling, in which there is a 3 fundamental factors. What is your attitudes, ethical practice, and also be the communicative. So ADCOM is mainly the manual in the learning modules for the MBBS professional as well as the MD and the DM. Nowadays we know regarding the intern doctors, the causes of the stress and the burnout syndrome toward the medical professions. So there are the multiple factors in which the medical profession has so much physical as well as mental health issues. The most burnout doctors are mostly in the surgical branch or the neurological branch or the neurosurgical branch, in which they have to deal with the patient with the ICU psychosis, ICU long-term ICU stays. We have to convince the caregiver as well as the patient's outcome. So this is a data is serving. So this is the urological, neurological, and the internal medicines and the profession who are involved in emergency medicine. They are mostly the burnouts or may be feeling very physical distress as well as the mental distress. The least burnout doctors are mainly the branch which is ultimately non-clinical, like the urologist, any microbiologist, or the plastic surgeon. There is no any emergency. In psychiatrist, there is no emergency branch. Dermatologist, there is the least burnout doctors in the professions. So these are the burnout syndrome. While the burnout syndrome occurs in the medical profession as well as the paramedical branch, because of the long working hours, no work-life balance, very high responsibilities, senior pressure are there. There is a toxic environment if in the medical college or the government medical college. We have to make the critical decision without opinion from the seniors. Fear of failure, competition, and the toxic environment. These are the major factors which are responsible for the burnout syndrome amongst the medical professions. In the academic parts also, there is a severe too much academics, there is a system injustice, a dirty politics between the CEO and the corporate world as well as the governments. There may be a day-to-day in a routine day-to-day practice in the medical profession. We hear the headlines regarding the suicidality or addiction problem, sleep-related problem, or mental health issue amongst the medical professions. Recently 2 days before there is an article in the દિવ્ય ભાસ્કર કે NHL મેડિકલ કોલેજમાં રેસિડન્ટ ડોક્ટરો માટે શિફ્ટ સિસ્ટમ છે. સારવાર પર અસર નહીં પડે, સતત 12 કલાકથી વધુ કામ નહીં લેવાય અને સપ્તાહમાં 48 કલાકની મર્યાદા. લાંબાઈ સર્જરીમાં સિનિયરની જવાબદારી સંભાળશે. This is because of the burnout syndrome in the medical practice. As we know, regarding the woodpecker syndrome is very much common. Everyone has a confess regarding the patients. Some patients in the ICU or during day-to-day activity, they are so much toxic. They're the same patient. Lots of relatives are coming up and asking the question, what are the treatment, what are the prognosis, patient saru thase ke nahi, aanu શું છે. So much question in repeated aspects. So they continues hammering our brains. Though because of the communications, we are the professional, we have to become very calm and composed. As we know, regarding woodpecker says a brain which is protected by the double tongue. So this is very irritating first. That's why the woodpecker syndrome is very much common. Nowadays, the Takosui cardiomyopathy, because of the state-induced cardiomyopathy in the youngsters nearly 35, 40 years of the age, we came to know in the emergency cases they are suffering from the various kind of metabolic disorder and are dead after the young age within the 35 to 40 years of the age. So whatever the, yes sir. Yes, 2 minutes. Okay. So whatever is be the toxic relationship with the relatives, you have to be a durandar of the part too. You have to keep the hosla in them but not taking badla towards the relatives. Give the time and don't rush, active listening with the calm body language and reassuring the touch with the clear and the simple explanations. But recently we saw the मैं आपके बच्चे का इलाज नहीं करूँगी. Such kind of the incident has been occurring in a government medical college because of the so much burnout syndromes. So we have to become calmness is a doctor's strongest weapon. Empathy can be dislodged whatever the medication cannot. It can calm down the anxious or the stressful patient, and the professionalism should be maintained to brighten the challenging moments. So whenever the kids beyond the hospital worlds, it becomes a lifelong world. This is a motto of the communicative as well as non-verbal communications. But whenever there is a doctor-patient relationship has been absurd, the complex word and the confused mind, the too much information overloaded, lack of counseling in the medical jargon, and the patient is searching for the second opinion clinics. So the different opinion doesn't mean the wrong treatment with the different perspective. Let's focus on the safest and the best for the patients, and the doctors should explain the both options clearly, so decide by themselves. So take them time, and we have to become the optimized towards the patient in taking the choice. So take home message will be the fall in love being a doctor with your professions. Communication speaks louder than your prescription. Small gestures always create big confidence in the patients. When the care goes beyond the hospital walls, it becomes a lifelong bond as a family relationship. Success is not a luxury, it's a trust of the thousands of the patients, but it is not by the illegal or the unethical practice. Be a good doctor. Always good doctors treat a illness, but the great doctors handles the emotions of the patient as well as the relatives. Thank you very much.
Thank you, sir.